Meanwhile, the Health Ministry is weighing in on the impact the zones of special operations are having on two of the country's three main health facilities. Dr. Christopher Tufton says the ministry continues to review security reports and concerns expressed by healthcare personnel who work at these hospitals. TVJ's Shamela Mitchell reports.
The first zone of special operations was declared in Mount Salem, Montego Bay in September, then last month in Denham Town, Kingston. The two areas are in close proximity to two of the three Type A hospitals in the country, Cornwall Regional out west and Kingston Public in downtown Kingston. Over the past few months, Health Minister Dr. Christopher Tufton and hospital officials have revealed that the facilities have been burdened with the number of violent trauma cases they were receiving. As a result, non-emergency surgeries had to be postponed and hospital resources were being depleted rapidly, not to mention a shortage of bed spaces. Since the zones of operations were implemented, Dr. Tufton says he no longer gets those complaints.
Well, the stats are there. I mean, the police have reported it, the Prime Minister has reported it. He had a long update that was given in Parliament on Tuesday, which clearly indicated a number of, gun fines, wanted men arrested, and a reduction in violent activity, gang-related or otherwise, in those defined spaces. Largely, of course, because of the presence of the security forces and the other actions that have been taken. So the hospitals would have benefited from that.
However, the health minister was quick to point out that the ministry is still not comfortable with the number of trauma cases. He says there will always be uncertainties as no one can predict when there will be flare-ups in some areas. In addition, Dr. Tufton said while the areas surrounding the zones of operations are quiet at the moment, there are areas outside where violence continues to produce casualties.
The way the public health system works, you're not going to find consistency. You're going to find increasing pressures at times, reduction in pressure in other times. And so you kind of have to manage the process and move it around, which means that you can't conclude that the situation is good at any point in time. And at any point in time, too, you can't say that the crisis exists everywhere. It's kind of a moving target.
Meanwhile, Dr. Tufton said the ministry is now reviewing the reports received from Savlamar, Cornwall Regional and Kingston Public Hospitals on threats to healthcare workers at those facilities. Doctors and nurses have been complaining that death threats were issued to them by relatives and friends of patients involved in violent incidents who were being treated at the hospitals.
It really is about looking at the existing arrangements that are in place. Now, we spend hundreds of millions of dollars each year on private security arrangements. So it was to determine whether or not we're getting good bang for the buck in those cases and whether we need to step up the pace. Now, where we have had flare-ups, the police, through communication and coordination with them, have actually created a presence, not a permanent presence, but more frequent pass-throughs to those locations.
Dr. Tufton did not say when the review will be completed, but assured health workers that action will be taken after the review. Shamela Mitchell, TVJ News.